The Centers for Disease Control and Prevention tell us that one of the best ways to curb the transmission rate of COVID-19 is by wearing a mask. While the Georgia state government hasn't created a mandate, local governments are taking matters into their own hands. And in order to make sense of that, we need some context. My name is Joseph, and this is AJC in Context. Now, if you don't feel like watching me or you just want more information, our AJC reporters Greg Bluestein and Ben Brash have a full story on this. It'll be the first link in the description down below. It is not just about masks. It's about a conflict between state and local governments and the potential legal issues that could arise from that conflict. As of recording this video, there are 5 cities in the state that require masks: Athens, Atlanta, Doraville, East Point, and Savannah. The issue is also up for debate in many other cities. Now, the details of every mask order are different. For example, in East Point, if you're outside without a mask, you can face a $75 fine. The same infraction will get you a $500 fine in Savannah. But one thing is clear: wear a mask. If you don't, you will be fined. But on a state level, Governor Brian Kemp, quote, strongly encourages the use of masks but does not mandate it. Supporters of the mask mandate say it could be well worth the potential legal fight, as Georgia recently passed 100,000 confirmed cases. Quote, it's unfortunate that local governments must defy the governor to protect our constituents, but he leaves us no option. His refusal to mandate CDC guidelines for wearing a mask forces others to lead. On a conference call with local officials, Kemp urged them to steer clear of mandates and use social media and access to media outlets to encourage residents to voluntarily wear coverings. But he stopped short of legal action. I realize that many on this call have different opinions on the appropriate response to this pandemic, and that's fine. But we all agree that masks are good and can help stop the spread, Kemp said. And that quote is especially important. Many public health experts say that the evidence is clear that masks can help stop the spread of COVID-19. States and countries with mask mandates are seeing a slowdown in their infection rate.
I think when you think about face masks, there's several types of face masks. There is an N95 mask, which is the one I would put on if I'm going to go in to see a COVID patient. That prevents me from getting the infection. What we're recommending people to use is a cloth mask or what I use in the hospital most of the time or at Emory, which is a procedure mask. It's a surgical mask or a cloth mask. That does not prevent as much me getting something, but it prevents me giving something to somebody else. It's almost like what a surgeon puts a mask in order to prevent the germs in the surgeon's mask and mouth to getting into the patient. So if we're all masking, the chance of if I happen to be infected and don't know it, and that's the reason for masking, because there's a fair amount of asymptomatic and pre-symptomatic transmission, then I can be close to you and you wear a mask, I wear a mask, the chance of you getting infected from me, it decreases by 75% or more.
So since we know masks work, the only real question is, do you think it's the government's job to mandate masks during a public health emergency? Let me know your thoughts in that comment section down below. And hey, while you are down there, go ahead and press that subscribe button if you haven't already. Press the like button if you liked this video, favorite if you really liked it. But as always, my name is Joseph and this is AJC in Context.